Caring for yourself and your baby after birth. The days and weeks following birth are a critical time in the lives of mothers and babies. This video covers important information to care for yourself and your baby after birth. Taking good care of yourself. The first few weeks with a new baby can be a happy time, but are also exhausting. Most cultures in the world have customs that allow new mothers to heal from the effort of birth, to bond with the new baby, and to rest and recover. You need to regain your strength. Your baby will feed every few hours, day and night. Rest with your baby and try to sleep when your baby sleeps. This is a time to accept help with the household work, making meals, and helping with your baby. Be sure to eat a variety of nutritious foods to build up your strength and your milk supply. Your body goes through changes. Your uterus should feel like a firm ball in the lower part of your belly. If it gets soft, rub it until it's firm. For several days after the birth, you should bleed about the same amount each day as a monthly bleed. Then the flow lightens. After a few weeks, it becomes light yellow, then gradually stops. If you are too active, your bleeding may restart. Rest. If the flow doesn't slow down, seek help. Sharing a bed again with your man. It's safe to have sex again once your bleeding has stopped and you feel ready. But remember birth control. You can get pregnant before you even start having monthly bleeds again. It's healthiest for you and your baby if you wait at least 2 years before getting pregnant again. Breastfeeding will usually protect you from getting pregnant for about 6 months if your monthly periods haven't started and you feed your baby only your milk and no other fluids or food. Talk to your health worker about birth control. There are safe and effective methods you can use after birth and while breastfeeding, such as the IUD, the implant, condoms, or pills with only the hormone progesterone. If you have completed your family, there are also permanent methods for both men and women. Know the danger signs in women after birth. Heavy bleeding. You're bleeding too much if you soak 1 or more pads in an hour, or your bleeding is increasing. Fever and weakness, plus a bad smell from your vagina and pain in your belly. This may mean you have an infection in your uterus. Severe headache or visual problems. You may have a dangerous condition called preeclampsia. Convulsions. You may have progressed to the life-threatening phase called eclampsia. Swelling, redness, and pain in one leg. This could be a dangerous blood clot in your leg. Fast or difficult breathing. This may mean you have a blood clot in your lung. Severe abdominal pain. You could have several serious problems that need evaluation. Severe sadness and anxiety. You may feel so sad that you cannot care for yourself or your baby. This doesn't mean you don't love your baby. The hormones after birth can affect some women emotionally. Seek care right away if any of these danger signs occur. Caring well for your baby. Watch for your baby's hunger signals, such as opening his mouth and turning his head. Feed him whenever he's hungry and as much and as often as he wants, at least every 2 to 3 hours, day and night. Feed your baby only your milk for the first 6 months. No water, sweetened water, tea, honey, formula, or anything else. Keep your baby warm. There is no need to wash him every day, but be sure to keep his face and bottom clean. Dress him with an extra layer of clothing and a covering on his head. Have your baby sleep on his back or his side, not on his belly. Keep him away from smoke. If malaria is common, use an insecticide-treated bed net to prevent malaria in you and your baby. If you have HIV, be sure to give your baby ARV medicine to protect him from becoming infected. Know the danger signs in babies. Fast breathing. Chest indrawing. The chest draws in with each breath. A cold body temperature. The baby's belly and feet are cold compared to your own. A hot body temperature. The baby's body is hot to touch. Not feeding. The baby doesn't act hungry and may not wake up to feed. Lethargy. The baby only moves when stimulated. Convulsions. The baby may have unusual eye or mouth movements or repetitive jerking of the arms or legs. If you or your baby have any danger signs, see a health worker right away, day or night. You and your baby need checkups, and your baby needs vaccines. Go to the health center 2 to 3 days after the birth, between 7 and 14 days, and 6 weeks after birth. Remember, after birth, get plenty of rest and healthy food. Feed your baby often and well, and keep him warm. Know the danger signs for you and your baby, and seek care right away if any occur.